I think that's a great question. The first thing is that immunotherapy is an incredibly broad term, and it encompasses many types of therapies, ranging from vaccines to cellular therapies to antibodies that are administered to a patient, so-called immune checkpoint inhibitors. So I think the first question a patient would ask is, what type of immune therapy may make sense for me? And the other critical piece is that these drugs differ from our other typical forms of anti-cancer therapy, and as a result, they have a unique set of side effects. They just work differently, and as a result, the spectrum of side effects and how those side effects may look are different. And then the last piece I would say is that immunotherapies, while so much emphasis has been placed on them and there's a great deal of enthusiasm about them, admittedly, they don't work in everyone. And so it's worth asking your doctor whether there are additional tests that can be done to get a better sense of whether these are the right drugs for you. The biggest thing is that things are changing, and things are changing rapidly. Mm-hmm. And these are drugs that require multidisciplinary care, both in terms of managing the actual oncology piece, but also in terms of managing the side effects. That these are, unique agents that have unique side effect profiles, and it really takes a village. It takes a village to administer these drugs, to educate our patients on what's to be expected, but also managing the other pieces, when these drugs work, but also when they don't work. When we see toxicities from these drugs, it's really about how to engage with other providers and get as much support as possible. So I think Mass General is a special place for many different reasons, but particularly when it comes to immunotherapy, because this is a field that is really brand new, and it's a field that we know so much about, but also at the same time, there's so many open questions. And Mass General's a unique place because it's a meeting ground for basic scientists, clinicians, really to come together to answer the biggest questions of the day. And I think immunotherapy, predictors of response, predictors of toxicity, those are the biggest questions of our day. And you need to be in an environment where people collaborate easily, but you have expertise. You have world-class basic scientists, immunologists, pathologists, clinicians, translational researchers, bioinformaticists in one place who can really help you answer those questions.